a number of vaccine candidates that are currently being considered, but there's one vaccine candidate that's giving us a lot of hope, and that's Covishield, being developed by Oxford-AstraZeneca and Serum Institute here in India. Here's why. It suits India a lot more than other vaccines because, number one, it's cheaper than other vaccines. So it can be spread out to all Indians, very easily accessible considering the prices. It can also be stored at normal fridge temperature, and you compare that to a Pfizer, which needs very, very low temperatures for storage, not feasible in India. A vaccine like Covishield doesn't need an expensive cold chain. It doesn't need cold chain storage. As I mentioned, can be stored in normal fridge temperatures. It's also much easier to transport when you compare it to, say, a Pfizer vaccine, which needs to be stored permanently at all points in very, very low temperatures. And with the kind of infrastructure we have, that's very difficult. Besides that, this vaccine, Covishield, is being developed by Oxford University and AstraZeneca. Trials have been going on here in India as well by the Serum Institute, and we've been seeing attempts to manufacture a lot of doses here as well. We've also seen that human trials have been taking place in India, so we have results of our own as to how we are reacting, how the Indian population is reacting to the Covishield vaccine. So those trial results are also with us. That's why there's a lot of hope on this particular vaccine. I want to take this across now to Milind Sharma. She's been getting us all the updates on the vaccine front. Milind, at this point, considering we're entering into 2021, a lot of questions at this point on whether in this year, maybe by the end of January, we'll actually have a vaccine.
Well, definitely, Akshita. Everyone's waiting for the good news. But let me also tell you what the government is thinking at this point of time. So the sources have informed me that when this SEC meeting will convene today, the major idea is to check the data of the indigenous vaccines that are being developed in the country. Now, we know Serum Institute of India has, in collaboration with Oxford and AstraZeneca, made Covishield. And that, the trials have completed. The trial data has been submitted to the SEC panel. So that remains the number one contender to get the emergency use authorization. Now, when it comes to Bharat Biotech's Covaxin, that's the second candidate and made in India candidate, the trials of phase 3 are yet to conclude. But for Pfizer, because that happens to be another candidate that has applied for an EUA, Pfizer is yet to do any trials within the country itself. So we don't know how the vaccine will react in the country's population. So as you said, Covishield happens to be one of those contenders that's most likely to get an emergency use authorization. And we'll have to wait and see how the SEC meeting pans out, because in the last meeting, they had said that the UK government had just given the authorization. So they wanted to go ahead and work on and analyze more data that came from the United Kingdom as well. But we're all waiting for a magic bullet. And crucially, this meeting that will happen at noon today will be a decisive factor in knowing which of these vaccines is going to be the first to kickstart the vaccination drive in the country. Akshita.
That meeting will be happening. We'll be tracking the latest and the big takeaways from that huddle. Milind, for the moment, thank you for joining us.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.